Hi and welcome. Let's see, this morning we're going to talk about forms, and more forms. Forms are kind of the thing that everybody needs to have in order to document a visit, and of course, the shorter the form, the better. But sometimes forms do take time to fill out, but of course, if we can get them filled out faster, that would be even better. So, I'm taking this from the beginning of logging into the system, and I just want to show you a couple things that we've done with our system so that you can get around better or faster. So, I'm going to go into this chart here, and all of our forms are attached to visits. So I'm going to show you this one right here, but I did it yesterday, last night, just got done with some stuff. So cranking away at this at forms that you guys can use right out of the box in the system. So right now I'm going to create a new encounter or visit, and from that visit I'm going to say it's an established patient. And now the thing that we can do a lot of things, but if you show us your form that you have, we can make forms out of whatever you have, or we can make shortcuts depending on what type of data you want to collect, how fast you want to collect it, and how fast do you need it to populate. So I'm not going to belabor this particular video with all the ins and outs. Maybe in a couple more videos I will do that, but for right now, as you can see, we rearranged our forms up here so that it kind of makes a lot of sense. Whereas you have your clinical forms of these types, and then you have your assessment forms, which are under assessments. Now your administrator forms are billing stuff and new encounter. Now under intake, we just finished this one here. And this is the one I'm going to show off to you in just a few minutes. Of course, if you have lab orders, then that's where your procedure order comes in, and you're going to be able to order prescriptions or medications for your patient. Now, this questionnaire thing, I'm going to do a whole video on this, about it so that you can figure out how this thing works, because it goes out and pulls forms that are standardized from other places out there in the world, which is the LOINT system. So if I click on it, so we can go here, but I'm not going to spend a lot of time on this. I'm just going to show you that it's there. But you can search for forms, and there are forms that are already done, and you can pull them into the system and make them a part of the system and reuse them. So for now, I'm going to go ahead and show you this intake form. This is one type of intake form. Okay, and as you can see, this is for mental health and wellness intake. Title is kind of long, but we can work with that. Anyway, I'm going to slowly scroll through this, and of course you can always stop the video and come back and read read what is here, okay, and go through it on your own more slowly, or just simply register for an account and log in and look at it all you want, and then you can fill it out and see how it works. Now, of course, this one's rather long because it's rather detailed, but it's one type of intake form, and also we tie this to the billing as well. So when you fill this form out, it fills out the billing so that if you have a biller, or if you're doing billing yourself, all you have to do is go to the, what's that thing called? The here billing manager, and pull up the claim and send it. So you can have it all done, or the billing done, right after you finish filling out this form. Now, I'm going to stop that. I'm going to show you the one that I did yesterday as far as the completeness of it. I had that there. I'm going to do this. I'm going to go back to here. If you notice when you mouse over stuff, it will show you the form, so you don't necessarily have to log into the patient's encounter to see the form that's there. It'll pull it up like this and show it to you so you could read it even without going into the file. And this looks pretty decent, doesn't it? And the other thing that can happen when you go to print this out as well, it looks like this. This is the printable PDF version of this form. And of course, it's not completely filled out, but you get the idea of what we can do with a form and its output. So this was just to show you that forms, everywhere forms, we can make forms or do forms that are going to help you guys, of course, document your visits and get your claims out. Thank you. I couldn't remember the rest of my words, but thanks for listening. Have a good one.